dear attendees, on behalf of the European Cancer Leagues, ECL, I would like to welcome you all to this webinar with title, Let's Break Down the Barriers Around Cancer at Work. My name is Nicolas Philippou. I'm the CEO of the Cyprus Association of Cancer Patients and Friends, PASICAF, and I'm also the Vice President of ECL. For those who don't know, ECL is a non-for-profit pan-European umbrella organization of national and regional cancer societies, focusing primarily in the areas of cancer prevention, tobacco control, access to medicines, and patient support, and creates opportunities to advocate for these issues at an EU level. Today, we are already underway the European Week Against Cancer campaign, and this year, the Association of European Cancer Leagues aims to highlight the focus on the role that each one of us has in accelerating the implementation of Europe's Beating Cancer Plan. Today, our focus is on cancer patients and survivors. And in this webinar, we'll try to raise awareness on the impact of cancer in the workplace, as we believe that cancer at work is still a taboo. Recognize there is still more work to do to put survivorship and quality of life issues into the spotlight of current discussions around Europe Beating Cancer Plan. ECL's Patient Support Working Group aims to bring together patients, survivors, and employers, including their representatives and organizations. The ECL Patient Support Working Group has been established back in 2002 by the ECL members and connects cancer care experts and expert patient representatives who work together on various topics such as access to insurance and financial services, return to work, caregiver support, cancer rehabilitation, and palliative care. Over the past 2 years, the group has been working on improving communication between employers and employees. And last year, we have issued 2 specific leaflets with tips for employees diagnosed with cancer and for employers working with staff affected by cancer, based on a more comprehensive handbook aimed at employers and HR departments, which was published back in 2020. In this webinar, we will present the ECL Patient Support Working Group's recent publication, and we will follow with moderated discussions with expert panelists and Q&A questions. We hope, and I would like to thank at this point the Monique Lin, chair of the ECL Patient Support Working Group, and our representatives that will be making the presentations on behalf of the group, and all the ECL Patient Support Working Group members for their great work and contribution in this important topic. I would also like to thank our panelists and expert speakers for making the time to participate in this webinar, all organizations that have endorsed ECL publication on cancer at work and are today with us in this event, and of course, all you attendees for being today with us and for your interest on the subject. We have a very busy webinar, so we'll go very quickly through the housekeeping rules for the webinar. Given the great lineup of speakers and the time constraint, this is a view-only event, which means that we will only be able to contribute by typing your questions in the Q&A function. Also, we will take as many questions as possible, sometimes grouped, but we cannot guarantee we will be able to answer all of them. Please take part and follow the conversation by tweeting and posting during the events using the hashtags Stop Cancer at Work and EWAC22. And please also note that the event is public and will be recorded. You'll receive an email with the recording and slides in the coming weeks. So with no further delay, I am delighted to pass the virtual floor to the Honorable Member of the European Parliament, Ms. Miriam Lexman from Slovakia and the European People's Party political group for her special address to the event.
Thank you very much. Thank you for the floor, and thank you to the organizers, the Association of League Against Cancer, for this very timely event. Dear participants, dear colleagues, and if I may, dear friends in a common goal, I'm delighted to open this event, a very timely event and very important event on the impact of cancer on people of working age, their families, careers, employers, colleagues, and the society at large. This is a very important topic, and that's why I'm delighted that you are using the Week Against Cancer in this way to raise the awareness on this issue. Although the awareness about cancer has improved, we still do see that we can do far more for the 1.6 million people who are at work, at the working age, and are diagnosed with cancer on an annual basis. The research and medical health has improved as well, but we still need to help these people to be integrated back at work and to create such a structure in the society that these people do not face discrimination and stigmatization in a society. It is 1.4 times higher unemployment among cancer survivors than among their peers and colleagues who have not suffered any disease of this kind. And that's why it's important that we all, policymakers, lawmakers, civil society, but also human resources departments at the employers, do think together how to reintegrate these people, how to help them to be part of the society as soon as possible, or while being treated against cancer. It is very important that together we accelerate the Europe's Beating Cancer plan, because we still are lagging behind many policy areas, and we do have the plan, and it's important that we use this plan in order to help not only the survivors, but their families and the society around them, their colleagues, but also the employers, in order to know how to support these people better and how to provide them a better care and better infrastructure so they can work while being treated or return to work immediately after they are treated and they become healthy again. It is important that all researchers, but also policymakers, work on the quality of life of these people, and we can together today think how to improve this. I was also delighted that we in the European Parliament, we have passed an own initiative report on the new strategic framework for health and safety at work. I have come with many amendments in this report because I'm constantly focused as a member of EMPL, the Social and Social Committee in the European Parliament. I'm constantly thinking how to improve the quality of life of workers, who many of them suffer diseases. And with the aging society, this might be, unfortunately, our challenge in the future. That's why I'm happy that all these amendments were accepted. I was also focusing on the carers, because it's important that carers, which are many and often family members of those who are diagnosed with cancer, that they give up work and they try to support their family members, and the society needs to provide adequate support to the carers too, as well as recognize their skills they learned during the time when they are caring of their family members, so they can also return to work, because this is another issue which is related to patients with cancer, that their relatives who are taking care of them are also having hard time to seek jobs after they can return back to work. That's why it is important many of these initiatives and these kind of laws are rethought, not only on the European level, but on the local level, on the national level, and then we promote the ideas which are generated also within this association among all the levels of policymakers in the member states as well as the European level. What also I welcome in this perspective is that the association's leaflet and handbook has already been translated into many languages, including my own, the Slovak language, that Liga proti rakovine, the Slovak member, has translated this handbook and leaflet, which is very important because we are raising the awareness on all the levels of policy making, which is important. I would like to congratulate the Association of European Cancer Leagues for this event, and I would like to conclude with the words that together we can break down the barriers between cancer and work. Thank you very much, and I wish you a very useful and fruitful conference.
Thank you so much, MEP Lexman, for all the work that you do, both for the patients and carers and for addressing today's webinar. I would now like to pass the virtual floor to Erika Carlden-Onsley from the Swiss Cancer League, who will be setting the scene, managing cancer at workplace. Erika?
So everybody see my screen. Thank you very much. Good afternoon, ladies and gentlemen, and welcome to this presentation, setting the scene, managing cancer. Oops. Sorry, now I'm here. Hello, everybody. Good afternoon, ladies and gentlemen. I think now it's working with our presentation to setting the scene, managing cancer in the workplace. As we already know, more than 1.6 million people of working age are diagnosed with cancer in Europe each year. And this quantity will unfortunately continue to grow. But we have good news because about 2/3 of cancer survivors return to work. They are able to work again. Up to 30% of these people have reported impairment in their ability to work. And mostly people affected by cancer suffer from multiple stress factors, and these always have an impact on their return to work. Let me show you the extent and complexity of these stress factors. First, you can see physical, psychological, familial, and social stress factors such as pain, fatigue, sleep disorders, changed appearance. On the psychological side, loss of control, difficulties in concentration, and quick changes in emotion. In a family, there might occur feeling of guilty because cancer patients are not able anymore to have the same role as before the diagnosis. And we know that relatives and family members might have the same psychological problems like the cancer patient as well. On the social side, it is important how the reactions of the environment is. Is it isolation, and how good is the quality of social support? And then, of course, financial stress factors. We know reduced and loss of income and unforeseen expenses. Work-related factors are reduced work performance, understanding or not understanding in the workplace, and fear of being fired. And the care system, there might be really challenging problems and stress factors too. For example, coordination of many treatment appointments, and flow or not flow of information between practitioners and therapists. And also how comprehensive or incomprehensive the language of practitioners and therapists really is. And at least existential and spiritual problems as well. At the same time, and despite and with all these stress factors and their effects on everyday working life, it is crucial that people with cancer can continue to work or return to work, because work means, especially for them, normality, routine, stability, social contacts, earnings, income, and self-esteem and recognition. In concrete terms, we can divide the impacts on reintegration into 3 groups. First, of personal factors, the type, disease type and localization of the tumor, the type of treatment and period since end of treatment. And then social demographic effects, such as age, gender, level of education, they play a role, and mental stability, coping strategies, and attitude towards work. Second, work-related factors, a positive relationship and a support in the workplace is essential. If there is an occupational health management, the better the chance to reintegration, and of course the willingness and concrete and realistic options from the employer to make necessary and suitable adjustments, such as adapt working hours, share responsibilities, and gradual work re-entry and learning new skills. There are other factors too, support and assistance from family, neighbors, and friends. It is always better to have somebody confidential and trusted third party, and it depends also the professional status. People without management functions, for them it's easier to return to work, and as longer as somebody works in a company, the better the chance to keep the job. Very important is the coordination with all stakeholders, and here, for example, is a good support of a case management. And of course, how are the legal conditions? Is there a daily benefit insurance? Is there a disability insurance? How is the protection against dismissal? And then after a successful treatment, after the therapy, nothing is ended, there might occur long-term effects, and they influence everyday working life, and careful handling is repeatedly required, weeks or months or years later. And then there are a lot of questions in the workplace. If somebody has a cancer diagnosis, the reactions in the workplace, and the period of absence, and the period of additional burden for the on the working environment, and the whole topic of communication, how to communicate, how to keep contact, how to stay in touch with the cancer patient. And then everybody might need support. The cancer patient, colleagues, carers, and also the team leaders, and who can give me support in the different roles. What happens if workability and performance decreases? What are the consequences? What are the rights and obligations of both, from the cancer patient and from the employer? What are concrete and realistic options and limits? Dismissal and discrimination we mentioned before. What are expectations from both sides, cancer patient and employer, and how realistic are these expectations? And at least, who can contribute what kind and what to deal and to manage as good as possible the situation, because everybody in the working environment can do good things and contribute in a good way. Well, what is a good practice? A successful work reintegration process is always the result of a combination of the following factors. First, personal, familial, and social factors, and very important, the role of the supervisors, of the team leaders. They have a key role because they are balancing between corporate responsibility and caring for employees, and they need time, space, and know-how for the active support of cancer patients and the team. And of course, I mentioned before, the existence and implemented occupational health management is very important, a positively experienced working environment with active support of those affected and to the team. It needs concrete measures for reintegration, coordinated steps with everyone involved, with all stakeholders. With the following presentations, you will learn about ECL's concrete contribution to supporting employers and employees. My colleagues will introduce you to the leaflets for employees and employers and to the handbook for employers. Thank you very much.
Thank you very much, Erika. It was all, I think, very clear, so I will go directly to my colleague, Wim Gelungens from the Stand Up to Cancer Flanders, who will present the first ECL leaflet for employees.
Hello, everyone. I'm Wim Gelungens from Stand Up to Cancer Flanders. I am trying to share my screen with you so I can show you my presentation. Normally it should be okay now. So I have the honor to give some information on the leaflet we designed for employees diagnosed with cancer. First and foremost, what is the leaflet all about? It actually serves as a guide. It contains practical advice for people diagnosed with cancer on how to start a conversation at work about that very diagnosis and how it actually affects or might affect their work life. So we really want to help in allowing the conversation to happen at the workplace. So really, we want to give patients some advice on how to introduce the topic, because also we saw in research that actually there's a large impact of a positive, stable, caring culture at work. It actually enhances return to work. At the same time, we also want to highlight potential practical consequences that people might be unaware of at the time they get the diagnosis. So what is the added value of doing this at the patient support working group? In my experience, it's actually so positive that we're able to build upon experiences from all over Europe. And on this topic, we actually saw that how, even though that there is a difference in legislation, of course, regarding return to work between the different countries, we still saw that people diagnosed with cancer actually struggled with similar issues at the workplace. So therefore, it's still a relevant topic. We also think and know that this topic will only gain more and more relevance as actually there's better earlier detection, better treatments, and therefore also better survivorship rates, meaning that there will also be more people confronted with cancer at the workplace. So that's why we decided to make the leaflets, and also because of the differences in legislation, we tried to focus really on practical aspects in the leaflet. So who is this leaflet for? As was mentioned before, every year it's 1.6 million people of working age that are diagnosed with cancer in Europe. So this leaflet is really aimed at those people. It actually meets the needs of all employees, regardless of the size or the type of their employer. So we really want to give some broad information and starting points to discuss this topic at the workplace. The structure of the leaflet, it's actually based around 3 stages, the same as Erika highlighted before me. So it's actually the stage of the diagnosis, then treatment, and then the period after the treatment. The first stage, the diagnosis stage, most important thing to know here is that you are not you're not obliged to communicate and share all the details of your diagnosis and the treatment with your employer. It really is a personal decision. Nevertheless, we know that maintaining a two-way communication with your employer can, for instance, help them understand what's going on with you and what type of support you may need. So it may be a bit easier for them to make adjustments or changes to your work to make that work easier for you. But it's still a personal decision. But when you decide to communicate, some tips we can give you is that you should know that your supervisor or your employer can only disclose this information to other people, for instance, your colleagues, with your consent. So they just can't go on saying what they talked about with you. They need your consent before they do so. It's best to think about the best approach for you. Is this a face-to-face conversation, or do you feel more comfortable talking about this in a teleconference? Things you might want to talk about are symptoms, the treatment you are getting, and also the impact on your well-being, on your work. It's also interesting to ask about maybe required work adjustments that you might need, a type of support you may need, and also the company's policy. Also a good tip to think about questions that you might be asked, so questions your employer might be asking from you when you disclose your diagnosis. And also know that a written preparation can be very helpful at this stage. Next stage is the stage of the treatment. And we see here that some people are able to and want to keep on working during their treatment phase. But really, this depends on your medical situation, also your preferences and the type of work that you are doing. So first and foremost, discuss this with your medical team, whether it is medically feasible for you to do so. Also here, prepare for the conversation with your manager or supervisor, because there you can really talk about possible options for adjusting your work, such as reduced hours, the option to work from home, maybe some lighter or different duties, changes to the workplace that you may need. Also, during this phase, it's really important to keep track of your treatment schedule and possible side effects. Also, allow yourself some recovery time. We see that some people are able to plan their chemotherapy sessions, for instance, for instance, planning them at the end of the week gives you automatically 2 days to recuperate from that session and from that therapy. So it's really important to allow yourself that time and also to set boundaries to make sure that you have your sufficient rest periods. So here, very important is to keep an open line of communication, to have regular follow-up meetings, because your medical situation might evolve in time, and it's important to be able to make the necessary adjustments when they are needed. The last stage is then after the treatment, the return to work. Here again, very important to inform yourself about occupational guidelines and policies that are in place at your workplace, and to communicate proactively with your employer, with your supervisor, to inform them about your health status, about potential side effects that may not be there at the time, but may show up in time. Also discussing potential adjustments that you may need. Again, here, very important also to keep an open line of communication. The medical situation and the impact of side effects can evolve in time, and it's good to have those meetings already planned in the agenda. So you're actually obliged, both you and your employer, to look at how things are going for you, how your medical situation is at that time, and what adjustments that you might need or might be necessary to enable you to keep on doing your work. In conclusion, 3 key points. Like I said, the importance of keeping an open line of communication, because we know the medical situation, it changes over time. Important to set boundaries to allow yourself those necessary rest periods. And also know that you are allowed to discuss with your manager reasonable adjustments that are needed at the workplace, and that you can, in a sphere of dialogue, look at what is needed for you to allow yourself to return to work or to keep on working during treatment. So that's a quick overview of the leaflet we made for the employees. And now there's nothing left for me but to thank you and to pass the floor back to Nicholas. Thank you very much.
Thank you very much, Wim. Thank you for your contribution. We will now have our first discussion with our panelists, coming from various backgrounds, both from patient and employee organization. More specifically, I will call for Mariam Beridze from ECL Youth Ambassador, Tony Musu, European Trade Union Institute, Karis Givralaki from the European Cancer Patient Coalition, and Juan Jose Fernandez from the European Patients Forum. Allow me to begin this discussion with Mariam. Mariam, thank you for being with us. You are a young cancer survivor yourself, a member of the ECL Youth Group, and a public health specialist. I would like to ask you to introduce first yourself and share with us your personal experience, and also let us know whether cancer is perceived as a great problem and taboo in the workplace in your country.
Thank you, Nicholas. Hello, everyone. First, I would like to share my personal experience as a cancer survivor. I will start with the ECL, how I joined ECL. In 2015, I joined ECL as a youth ambassador, and those 7 years I was trying to promote European Code Against Cancer and living the healthy life, at least I was trying. And in 2019, I went to regular ultrasound checkup and checked my thyroid. And out of blue, it turned out the nodes were suspiciously malignant. And when I did the biopsy, it turned out that I had a papillary thyroid carcinoma. And also there was some metastasis. And I did not have any symptoms at all there. Therefore, I would like to emphasize the power of screening, and it's crucial to check your neck. And today, talking about the cancer at work, I'm sharing my personal experience. When I was diagnosed with cancer, my coworkers, the president of the organization, we are so supportive, and where I used to work, it's Croatia International Foundation. We're such an amazing, encouraging, and helpful people there. And when I find out that the cell was carcinoma, my manager suggested sending the biopsy to Germany to double check and to make sure that there was no mistakes, and the organization covered all the expenses. This was a mention, and this is the fact that cancer survivors have 1.4 times higher risk of unemployment. And this was not my fear in my case, because I was so lucky to work at CIF, and I had 5 stars insurance, and all the treatment related costs we are covered by this insurance. And so in my case, the financial obstacle was not my fear. And this is such a relief when you're young patient, young cancer patient. And in Georgia, it's not that taboo, but one of the obstacles and difficulties is financial situation, because we are still, Georgia is still a developing country, and we are still thriving for it. And in our case, to have good insurance and the good support from the team, it's important. And also, I'd like to comment on the leaflets, that communication between employees and employees is really crucial. And the tips from employees are mentioned in the leaflets. It's important, because how to do, sometimes the employees are a bit confused, and the leaflet guides you what to do, how to talk to the employees when they're diagnosed with cancer, how to manage their absence during the treatment, and then lastly, how to prepare the employees getting back to work after the treatment. And also the second leaflets for the employees is really handy, because when you're diagnosed with cancer, you're confused how to communicate it with your coworkers, with people around you, and how to work during the treatment, and what is the phase, and how to get back to work. So it's important that those leaflets are translated in many languages, and I'm aiming to translate in Georgian as well. And I wish every organization, every company knows how to behave with the cancer patients and how to help them. So thank you, Nicholas.
Thank you, Mariam. Thank you for sharing your experience. And it seems that it was a quite positive one, depending, I guess, on your employer, and not necessarily on the policy or the culture that there is in Georgia. Is this correct?
Yes, that's correct. I was really lucky, but not many patients have this opportunity to experience this luckiness, how I would say. And in general, there is a government insurance, universal health coverage that covers some financials, some cancer-related treatment expenses. But still, when people are diagnosed with cancer, the one thing that comes in our mind is that how should I overcome this? What will be the related expenses, and how people will have the attitude towards me. So there are a lot of information going around, and it's important to be everything structured. And yes, thank you.
Great. And one last question. Having now and seeing the ECL leaflet, and going back in your case, will you do something different? How would you use that leaflet in order to have a better communication with our employer?
Thank you. So I'm a public health specialist, and at the organization we are used to work, there were a lot of the physicians, the doctors, so they knew how to communicate with me. And also, like, I would like to disseminate and share these leaflets to different companies and different organizations, and using my platform and social media to distribute and disseminate. And because it's handy and useful that each of organization needs to have it, that easiness, the communication between patients and employees.
Thank you, Mariam. I just want to remind people that you can type your questions in the Q&A function. I already see that we have a couple of questions, but allow me first to go to our next panelist, Tony. He's coming from the European Trade Union Institute, and Tony, you have carried out extensive research on occupational cancer and worker protection legislation. Can you tell us more about the extent of occupational cancer in Europe and what has been done so far by the EU institutions to tackle this problem?
Yes, thank you very much. Thank you for the invitation to this webinar. So indeed, in our research institute, ETUI, we are doing research on occupational cancer, and I would like to address this important question because indeed sometimes cancer is due to work. So it means that workers might be exposed to carcinogens during their work, and so it means that the origin of their cancer is the working conditions, the bad working conditions. And so in 2017, we did a big study on the costs of occupational cancer in the EU. And the first step in that study was to try to understand how many cancers are due to the bad working conditions. And the results of the study are that between 8 and 12% of all cancers are due to work, to bad working conditions. So between 8 and 12%. So that's quite huge. Those cancers are unfortunately invisible because, as you might know, there is a delay between the exposure to carcinogens at work and then the onset of the disease. And most of the time, the disease, the cancers, they start after retirement. And so it means that cancer patients, they don't always make the link between their occupation and their cancer. But still, it's important to know that these cancers exist, and most importantly, that they are preventable. Of course, if workers are not exposed to these carcinogens at work, or if they are less exposed to them, we can prevent those cancers. And for that, we have in the EU some legislation. We have, for example, the Carcinogens, Mutagens, and Reprotox Directive, which aim is to prevent cancers at the workplace. And so employers, they have to do a risk assessment to check whether carcinogens are present at the workplace. It might be chemicals, it might be solvent, it might be pesticides, and so on. And these employers, they need to take all the measures that are needed to protect the workers from those hazardous substances. Recently, this directive has been amended, and one of the improvements is the recognition that, for example, nurses in hospitals that are treating cancer patients, they are themselves exposed to hazardous substances because the drugs that they are using to treat cancer patients are also carcinogenic to them. And so if they don't take the necessary precaution to protect themselves while treating their patients, they are also exposed, and later on they can get cancers. So that's one example of exposure to carcinogens at work. That's quite unfortunate that this example is precisely from nurses or healthcare workers treating cancer patients. So we can say that well, the EU legislation is progressing. The EU legislation on workers' protection is progressing, and now there is recognition that, for example, these hazardous drugs should be handled with care in hospitals, for example. So that's an important example. But I would say that, of course, coming back to your leaflet, it's important to help cancer patients return to work. They certainly need help because not all cancers, of course, are related to work. There are many other reasons to get cancer: the genetics, your working, your living habits, and so on. And so, and indeed, work is an important factor also to help patients to recover. And so, your leaflet is, of course, welcome. Thank you.
Thank you very much, Tony. Yes, indeed. We believe that occupational cancer are part of the discussion, cancer and work. So we are very happy to have you with us. And I will follow our discussion with Ms. Haris Givralagi she's the director of European Cancer Patient Coalition. Hello, Haris, and congratulations on your newly established board. I know that you had your annual conference in General Assembly last week. Pasi Kafi is also a member of ECPC, so we know you very well. So my question to you, as representing patients, ECP is an umbrella organization of patient organizations in Europe. What would you and your members wish that employers and policymakers do better to support the patients and the survivors staying at work, if they wish to, of course, and those who want to return to work?
So good afternoon, Nicolas, and first of all, thank you very much for the warm wishes and for your collaboration so many years, but also for giving me the opportunity to represent the cancer patient's voice at this discussion. Congratulations also on your valuable contribution on cancer at work, the topic that we are discussing here today. And it is true that there is an open European, I would say, strategy on survivorship, not just about work. And there is a huge disparity among countries as well. So in some, for example, Eastern European countries, survivors get very little protection, if any at all, while countries such as France, Italy, or the UK, they have extensive rights. So going back and looking at the numbers in the past years, statistics on cancer survivorship in Europe, of course, have improved significantly, as cancer survivors increase by 3% every year. And it was encouraging to hear Mariam's positive experience at work. However, the numbers also show that cancer survivors, as it was previously mentioned, have 1.4 times higher risk of unemployment compared to healthy peers. So it is important also to mention here that job loss, financial distress, financial toxicity resulting from decreased earnings and at the same time increased spendings after cancer diagnosis are linked also to emotional distress and decreased quality of life for cancer patients. So once the cure of cancer is declared or during treatment, if the patients wish show, they should be able to go back to their lives like other people of similar age, similar socio-demographic characteristics with no cancer diagnosis would do. And continuing or returning to work can bring a sense of normalcy as well as needed financial resources. However, there are several reasons that render the return to a normal life as challenging at the moment. So across Europe, having a history of cancer can be a major hurdle for returning to work, but also access to financial credit services and particularly payment insurance products. And these are issues that ECPC has tackled through the Right to be Forgotten project with the guidance of Professor Françoise Monnier. So now the European Commission in its plan has recognized that, of course, more needs to be done in order to facilitate patients and survivors' social integration and reintegration in the workplace. And of course, in this situation, the employers play the biggest role in the successful return to work for survivors, but don't always understand, I would say, cancer in terms of its treatment or its emotional and physical impact. And in addition, they do not know many times what best practices looks like. So this requires, in my opinion, a twofold approach. First, through incentivizing good practices promoted by the EU, and secondly, by introducing employment legislation that treats cancer patients as a disability to protect workers from discrimination. In addition, I would like to add that policymakers and professionals don't always consider work as a primary outcome of treatment and care, and this is very important. So at ECPC, during the past period, through the Cancer Complications and Comorbidities Initiative, where we had the contribution also of more than 30 European organizations working in cancer, but not only, we have provided a large number of amendments to the BECA Committee report concerning the needs of cancer patients, but also their carers. And we are committed to continue monitoring the implementation of the plan towards the final report direction. And more specifically, I would like to add also to monitor the fostering of support to member states in promoting reskilling and upskilling programs to help cancer survivors and patients rejoin the labor market. The launch, of course, of the new study related to the return to work of cancer survivors, mapping national employment and social protection policies, and identifying obstacles and remaining challenges. Because as we all know, gaps in access to social protection can put the welfare of individuals at risk, increase the economic uncertainty for both patients and survivors, and can lead to poorer health outcomes, of course. So in the upcoming Occupational Safety and Health Strategic Framework, the Commission will look into psychosocial risks and disadvantaged groups, including the cancer survivors, while in addition, the action plan to implement the principles of the European Pillar of Social Rights will cover working conditions, social protection and inclusion, health and care promotion for all workers, and again, included those affected by cancer. Furthermore, the recent Green Paper on Aging is launching a wider debate, including access, quality, and affordability of care, and long-term impacts of social protection systems. And having said all that, we at ECPC, we want to ensure that cancer and cancer patient rights will remain on the political agenda in general, but also beyond the conclusion of the work of the Europe's Beating Cancer Plan and Cancer Mission. And in this direction, we will launch a new ECPC working group to monitor and work on the social aspects of cancer. And we are more than happy to invite all of you to work together to break these barriers and improve the life of cancer patients, the survivors, but also their carers. So thank you very much.
Thank you so much, Haris. Indeed, you've raised so many issues, but also so much has been happening so many follow-up questions. Unfortunately, we don't have time now, but we're coming back at our last part. So I will go directly to Juan Jose Fernandez. He is, as I said before, from the European Patients Forum, which is an umbrella organization of national patients federations. I myself have the honor to participate at EPF's Universal Access to Working Group, representing the Cyprus Patients Federation. And I know the important role that EPF has in terms of health policy in Europe. So Juan, thank you for being with us. And my question to you is quite simple. Why has EPF endorsed ECL's publications on cancer at work? And a follow-up, why is cancer important for EPF? Please your mic, Juan, if you can unmute.
Well, I hope that you can hear me now. First and foremost, thank you, Nicholas, for the questions, and thank you to ECL for the invitation to the European Patients Forum to speak in this event. Well, first, to begin with, I would like to give you a very, very brief introduction on who the European Patients Forum is. And from there, I will explain why we have endorsed this leaflet and why cancer is important to us. Well, we are an umbrella patient organization, meaning that all members are not individual patients, but patients organizations from all across Europe. And the organizations that conform our membership, 78 in total, are disease-specific organizations or national patient organizations. They may operate in only one country or in several at the same time. Now, despite us being a cross-disease patient organization, meaning that we will not focus our work on any particular disease, we decided to endorse the ECL's handbook and leaflets because they are, first and foremost, they are very, very useful and important to the wider patient community with non-communicable diseases, because many of them have cancer. You know, not only do they have their own disease, but they also have cancer as a comorbidity or the other way around. Plus, we believe that this leaflet is also applicable to any chronic diseases represented by the organizations that we represent. We also think that the importance of this leaflet comes because if cancer is acquired at the workplace, that is one more reason for fighting it, meaning that we need to stop so many health inequalities being in the European patient community, and we need to stop, as we often say, the best cure is prevention. So we need to stop cancer from appearing where it happens, and the workplace is a key place in which no one should have to experience this. Then finally, and in the interest of time, we would like to highlight that we as European Patients Forum, we advocate for the need of policies, especially those that are related to the workplace, to be co-created with end users, that is with patients. So these policies are fit for purpose, and these policies do address the needs of patients, our soon-to-be patients, that is citizens on the ground. I'll stop here. I know it was a very short intervention. Hopefully I will have the time to pick up later. That said, thank you very much for your question. And again, thank you for the invitation.
Thank you, Juan. Thanks for this. Indeed, we are running out of time for this session, but a quick follow-up. Have you had similar handbooks for other diseases? Have you endorsed similar handbooks? And if so, perhaps we can discuss a little further at the last part of our session.
Sure. I believe the question is for me. The answer is unfortunately not. This is the first handbook and leaflet, to the best of my knowledge, that we have endorsed on cancer. We are open to endorse more if they are of the same high quality and standards. And more than hopefully, this ECL has opened a new path for other organizations to follow.
Great. Thank you, Juan. And thank you to all the panelists. Please stay. We will come back at the last part of our session. But keeping up the time, I would like to move forward, and I would like to give the virtual floor to Clara Rosas. She's the manager at the Catalan Federation Against Cancer, who will present the ECL handbook and the leaflets for employers this time. Clara, the floor is yours.
Thank you very much. I'm really delighted to join everybody here today. Well, I'm Clara, manager at the Catalan Federation Against Cancer based in Barcelona. The Catalan Federation Against Cancer has been developing its cancer survivors program since 2016. And this program includes the Cancer at Work project that wants to raise awareness among organizations to establish a plan to manage cancer at work. Since 2018, I'm also the leader of the patient support working subgroup, Cancer at Work. So let me introduce the handbook. We have published this handbook in November 2020. The main purpose is to help employers to manage cancer in the workplace, to understand how to best support employees and or caregivers affected by cancer, and how to minimize the impact on the organization and everyone involved. I want to highlight that the handbook can be used by any human resource managers, supervisors, or managers in charge of employees, and depending on the size of the organization, for the occupational health managers and occupational physicians. And many of the recommendations that are included in this handbook can also be very useful for managing other chronic diseases. The handbook has four parts. The first one explains why it's necessary for employers to adopt this comprehensive policy and set of procedures on managing cancer in the workplace. We have collected all the updated data on this topic, and it contains the size of the problem, the economical impact on society, the cost for the employer, and the benefits of supporting employees to stay at work. The chapter 2 provides useful tips to help employers to navigate through cancer challenges during the cancer pathway when an employee gets diagnosed. And there are 4 different stages that have been previously mentioned. When an employee gets diagnosed with cancer, when he's receiving treatment, when he returns to work, and when the return to work is not possible. The next part has the same structure of the previous chapter, but the recommendations are for an employee who is a caregiver. That is, an employee who, on the top of the daily job, needs to care for a close person who is affected by cancer. And the last part, for me, it's very interesting because it includes a selection of good practices from various employers on how they have handled in the past cancer in their workplaces. So we have done a qualitative survey of 20 companies across Europe. And as a result, the handbook offers these experiences, these examples that may inspire other companies and employers. Now I would like to introduce the leaflet, the employer's leaflet. Well, we have published these leaflets 1 year later in November 2021. And as I said, the employer's leaflet aims to resume the main tips to support an employee during the cancer pathway in the workplace. It points out some important issues that the employer should keep in mind when an employee or caregiver gets diagnosed with cancer. First, every cancer is unique. So that means that each person reacts and copes differently when they learn they have cancer. Second, many employees continue to work while being treated for cancer or return to work shortly after the cancer treatment is completed. Nevertheless, as you know, cancer and its treatments leave behind important emotional and physical side effects. To know them can help employers a lot to understand the employee reactions during the whole process. And last issue that it's really important to keep in mind, is communication. It's crucial and has to be clear and transparent at all stages with the employee affected and with the rest of the organization. Now I would like to highlight the main recommendations at each stage. In the first one, when the employee gets diagnosed, the employer should create a safe space where the employee feels secure to disclose their diagnosis because it's not compulsory. So the employer should check the legal framework because it's an important issue to take into account. It's important to be aware and understand the organization's legal obligations when it comes to sick leave and labor protection of an employee with a disability or chronic disease. So the legal framework can be very, very different in European countries, as it has been mentioned. At that stage, the employer should make the necessary arrangements to temporarily cover the employee's tasks when the employee requires time off from work. And at that stage, The employer should show empathy and care when an employee shares a cancer diagnosis. He should focus on the employee's needs rather than the needs of the workplace, and he should be practical by offering help in specific ways. And of course, he has to make an agreement with the employee. Ask if the employee preferences concerning communication channels and frequency. Ask if the employee wants to be kept up to date with what is happening at work. And in agreement with the employee, inform their team and colleagues about the situation, communicating only the information that the employee wishes to share. In the next steps, if the employee can continue to work during treatment, the employer will put reasonable adjustments in place and comply with the country's employment law. If not, if the employee is in a sick leave, the employer should redistribute all the tasks internally in agreement with other colleagues, and if needed, come up with a more sustainable and long-term solution. At this stage, the employer should show continued support, actively listen as the employee shares their concerns and acknowledge their needs and feelings. And of course, to be flexible with the previous agreements, because you know that the cancer process is very uncertain and may cause changes in the employee's preferences. So the employer has to accept this new agreement, these new preferences. And after some time, the employer should explore with the employee their needs, wishes, and possible options for their return to work. Due to short-term side effects, a gradual return to work is often the best solution, but if the legal framework allows it. And when preparing the return to work after treatment, the employer should inform himself about the common side effects that the employer might experience after treatment. So that means the cancer impact. He should make reasonable adjustments and modifications to the employee's workload. The employee should be allowed to restart working at their own pace, but at the same time, the employer should ensure that the key tasks are covered. And at that stage, the employer should schedule regular meetings with the employee to discuss and understand the personal situation and needs at that moment. Make an agreement with him and write down what has been agreed together and set clear timelines. And then, with the agreement of the employee, inform the staff about the employee's return to work and explain which decisions have been made to their reintegration at work. I would like to explain that we have developed these materials because we realized that it's necessary to help managers, to help employers to manage cancer in the workplace. We are in a new paradigm. The number of cancer patients will increase. Thanks to new treatments, cancer is a chronic disease. And as it was mentioned previously, the significance of works nowadays for a lot of people implies normality, work implies stability, and of course, work implies a source of incomes. So that means that in the future, more cancer patients will return to work or even keep working during treatment. But in this new situation, it's normal that employers need information and advice on how to support their employees. Employers may lack the confidence to address this topic with affected employees and with the rest of the organization, with many doubts to find the balance between compassion and responsibility. So these materials can help them as a guide to maintain careful, close, and appropriate contact with employees and with the rest of the organization. And what will be our next steps? Well, as you know, we have published these materials. Now they are available in different languages, but this is only the first step. The real challenge is to raise awareness among employers on this topic, and it's not easy. So the Patient Support Working Group is still working on the dissemination of these materials. We will participate in October in the World Cancer Congress, introducing these materials and talking about this topic. And we are trying to participate in other international events. Our assumption is that these materials are a win-win resource for both parties. Firstly, employees are less stressed and feel understood in the workplace. And secondly, the employer is well prepared for managing the situation. So these materials can help employers and employees to increase their confidence on how to manage cancer in the workplace, and of course, and overcome the barriers that are still in place. So I would like to encourage all employers to put in place a comprehensive cancer at work policy in their organization. Thank you for your attention.
Thank you so much, Clara. And again, please allow me to say that all the members of the Patient Support Working Group, you are doing an excellent job. And you are carrying a lot of experience, and you are applying that experience and know-how into this theme as well. And we're looking forward as well to seeing you at the World Congress.
Okay.
So definitely we want to hear the reflections from the key players. This is why we have a second now panel discussion. We have Marine Cavet from the European Agency for Safety and Health at Work, Ellie Matsuga from the European Association for People Management, Erika Carlen from the Swiss Carson League, and Claire Champagne from the European Association working with carers. Please forgive if I don't pronounce everyone's names as I should. And I'm gonna, I would like to make the first question and start this conversation with Marine. Hello, Marine, and happy to have you with us. So please tell us why did the agency endorse this leaflet? And subsequently, why is cancer return to work important to the European Agency for Safety and Health at Work? We do know that, for example, that you're already doing some work on return to work and rehabilitation. So please tell us about that as well.
Thank you very much. First, to say what the European Agency for Safety and Health at Work is, we are the European body responsible for collecting, analyzing, and disseminating information to serve the needs of those involved in safety and health at work. We are working on work-related cancer and exposure to carcinogens, but as Tony Musu explained already about it, I will focus on the question that you asked me. Thank you. So why did we endorse this leaflet? EU-OSHA was very happy to have had the opportunity to comment on and endorse both the handbook and the leaflet for employers. We published ourselves a leaflet with step-by-step guidance for employers on what to do when an employee is diagnosed with cancer back in 2018. So when we got to see the handbook and the leaflet for employers that ECL developed, we realized that they were very much complementary to what EU-OSHA did, and more detail related to practical guidance, including tips and checklists, together with good practices from employers. What was really appreciated by EU-OSHA in these two publications is the importance on the understanding that the workers' wishes for privacy is crucial. So there are very practical and good advice in the handbook to ask the employee explicitly what the employer can share with the colleagues, and in order as well to prevent possible gossip about the absence of the worker. So there is a specific tip in the leaflet in this sense. Also, what raised our attention and what I think was very important is the mention of re-evaluate the situation regularly with the employee, even if everything seemed normal, because we know, as mentioned by the previous panelists before me, there are side effects after diagnosis and treatment of cancer. So the situation can change even if you cannot see that. So that's some of the reasons why we endorse the leaflet. And why is cancer and return to work important to the European Agency for Safety and Health at Work? First, we are well aware of the detrimental effects of being out of work for an individual, related to his or her well-being and also finances, but also the situation as economic consequences for businesses and society as a whole. So in 2009, working days lost as a result of cancer were estimated to have cost the European Union 9.5 billion euros. Therefore, it is essential that companies implement effective strategies to help their employees stay or get back to work following a diagnosis of cancer. According to previous research, we know that there are fewer reintegration measures and back-to-work measures for workers affected by cancer in comparison to other chronic diseases or disabilities. So, but we know also that more and more cancer survivors return to work, and it is important to facilitate their rehabilitation. So EU-OSHA looked into this issue in a project exploring the implications of cancer for workers and workplaces across Europe. Professor Angela de Boer from the Cornell Institute of Occupational Health at the Academic Medical Center in Amsterdam led this project some years ago, and we have published reports identifying instruments, practices, policies, and interventions that can promote the successful rehabilitation and return to work of cancer survivors. There is an 8-page summary of the report and the leaflet for employers, which are both available in several languages, up to 25 languages for the leaflet. In our website, I will share both links in the chat now. And I think this is pretty much it in case, yeah.
Thank you, Marine. It's a huge number, the 9.5 billion you've mentioned before. And I was curious, is there a study maybe counting the economic effect of cancer patients remaining unemployed or not being able to return to work? Is there something that counted that impact, or maybe something that is being under study?
Okay, so I think it was mentioned previously, the persons surviving cancer, they are 1.4 times more likely to be unemployed following the diagnosis, and the average return to work is, I think in our study it was 64% after 18 months. I have seen today more recent numbers presented by Erika at the beginning. So I would think they are better numbers than from our report that is a bit older. But yeah, this is the numbers we have.
Thank you so much, Marine. And definitely those people not returning to work, they do receive social unemployment support. So there is an economic impact on that as well, I'm sure. So our next panelist is Ms. Ellie Matsuka from the European Association for People Management. Ellie, thank you so much for being with us, even though the weather outside is really great, and I know that for sure because we live in the same country and city. So I would like to hear your perspective as a corporate well-being expert and organizational culture consultant. Why do you think it's important for organizations and companies to take intentional actions towards raising awareness and breaking the taboo around cancer?
Hi, Nicolas, and hi to everyone, and thank you for inviting me in this great initiative. One could definitely argue that it is the right thing to do in terms of ethical stand of view, but I would like to focus more on the evidence. And there is a lot of evidence now that could support the discussion about the why organizations need to support and take intentional actions to support people, their employees that are going through cancer or even their carers. And I'm pointing out on evidence because from my experience, this is normally the language that needs to be used to convince the CEOs, the top executive, or the organization in putting resources on specifically on this. The first evidence that I would like to share and to point out is the sustainability in business. In the last years, there has been a lot of work done on sustainability in business, and sustainability is not only about taking actions to create a sustainable future for the environment, the society, or other key stakeholders of the business. Sustainability starts with the everyday actions and the way that the business is treating its employees for creating a sustainable future for them as a workforce and as human beings. There is a lot of research which shows that organizations that are taking actions towards sustainability have managed to increase the engagement levels of their employees and the loyalty to the company, which, considering the great resignation that we're going through at a global level, and considering the scarcity of talent, especially specific sectors and fields, this is a great evidence or an important reason why organizations need to invest on this. Another evidence that I would like to point out is a recent survey conducted by BCG, the Boston Consulting Group, and the World Federation of People Management, and endorsed by EAPM. Then on that specific research, we had more than 6,000 participants, mostly HR people, from more than 100 countries. And one of the results was that employee well-being was rated as a third priority in terms of future importance. So what does this mean for us? It means that based on the observations, the analysis, and the experience of the HR people, so those that are primarily responsible for taking care of the employees in a business. So based on their feedback, companies need to invest a lot on and taking actions to support their employees' well-being. And I should say that there has been a good progress on this, but mainly focus on mental health, I would say, and diversity and inclusion. But there is still work that needs to be done in terms of supporting cancer at work.
And I believe that what the ECL is doing and this initiative, it's a great platform to open the discussion at an international level, create awareness, and definitely the handbooks and the leaflet can be taken out and lead to initiatives either at a national level or at an organizational level, in order to set up policies and start making, taking intentional actions towards it. So there are definitely a lot of more reasons to point out, but the evidence and the statistics and the research done on the reasons why companies should support this area, I will emphasize it on those points.
Thank you so much, Ellie. We will come back with our final part and discuss a little bit more on what you've mentioned. Allow me to go straight to Erika and ask Erika, as we have heard from Ellie, the evidence is there, and we know that employers nowadays are embracing diversity and are getting also lots of support on how to create policies and best practices to create this safe place in the workplace. So in the case of the Swiss Cancer League, you offer to employers help and support on how to better care and support their employees going through cancer. So I would appreciate if you could give us an overview of these services, and also based on your experience, tell us your opinion on whether the ECL leaflet could be a useful tool to help start conversations on the ground.
Yes, thank you, Nicholas. Thank you, everybody. I'm glad to be here and to let you know something about how it works in Switzerland. Well, it was mentioned before several times that employers probably have misperceptions regarding cancer patients and survivors' work abilities and their productivity and reliability. And sometimes they think, oh, if somebody has cancer, diagnosed by cancer, she or he cannot work anymore. But it's not true. So employees affected by cancer suffer from these misperceptions, and they suffer from the lack of effective communication with the management and HR. That's why we created leaflets and a handbook, and we try to clarify and to give information in presentations like here now, in a webinar or on site, and in workshops on site as well. We do this on events and congresses, and we go into the companies, so on site. We work with co-workers, with employees, and with HR and management. And for example, with the presentations where we give information on cancer in general, early detection and prevention, and how to manage cancer in the workplace. In the workshops, we focus on managing cancer in the workplace, and we let the participants discuss in small groups. So they have to work, and then they present their findings in a plenary. If there is a specific question or requested, we will include a role play also. So participants can experience how in a short 10-minute conversation can go when an employee informs the supervisor about the illness, and they discuss. We implement three different attitudes for employees and employers, and we mixed these attitudes so they don't know what the other person will say. and then they share the experiences, what was good, what was not good, what is needed as an information, and how should this communication work. So we have presentations, we have workshops. We also have a specific email address for any question regarding cancer and work. Employees and employers can write us their questions and email, and we will answer it. And finally, we have developed leaflets as well for employees, for managers, for colleagues, for the team, and also for carers who are still in the working process. And we also have a handbook for employers. And which is important in our experience. We have these handbooks in 3 languages, in German, French, and Italian. And the leaflets also in English, because in Switzerland we have 3 regions of language. We have a German part, a French part, and an Italian part. And as we heard it before, it is very important to be aware that cancer still is a taboo. And regarding to the cultural differences, German or French or Italian, there is another kind of taboo. So we can speak more openly in the German part of Switzerland and less open in the French part, and in the Italian part of Switzerland, it's really a taboo to speak open about cancer. And that's something we realized, and there is very important to adapt the communication and to adapt our informations as well. Just let me tell something how we did it. Between 2016 and 2019, we have held over 70 presentations and workshops with around 2,000 participants. And it was crucial that we had personal contacts, a good personal network to HR and to CEOs. If we don't have these contact, we are not able to go into companies and make workshops and have information. So that is something really important, how to make known all these offers and handbooks and leaflets. I think that's, for the moment, it's the best thing I can tell you and share our experiences. And thank you very much.
Thank you so much, Erika. And maybe now it's the right time to ask you, we have a question on all these workshops and all this interaction you had with CEOs and HR. Did you also have an interaction with company doctors? And do they also have a role to play? Because I don't know what the situation is in each European country, but for example, in Cyprus, based on the health and safety regulations, you also need to have a company doctor.
I didn't understand if we had contact with who?
With doctors, medical doctors
okay.
that are responsible for health and safety issues within an organization.
Yeah, no, in fact, we didn't. It were only, only employees and employers, but I worked for 25 years at the disability insurance in Switzerland. And there I had a lot of contact with practitioners and doctors. And also another experience is very important to open the discussion and to open communication between doctors and employers. It's really a tricky thing because a doctor is not obliged and is not allowed to give information without the agreement of the patient, of course. At the same time, it is very important that the doctor knows something about what the cancer patient has to do at work, and the employer, that he knows, what are the limitations, but what are the options, in which phase of this treatment or return to work. So this share information should be very, very important. And well, in Switzerland, we have a kind of an online platform for employers and for doctors, and there are a lot of information they can share with the agreement of the cancer patient.
Thank you so much, Erika. And yeah, indeed, in our experience as well in Cyprus, it's very important for the doctor to share with the patient the care plan, so the patient knows it exactly when he will be able to perhaps ask for a holiday because of his condition or the results of the treatment. So thank you, Erika. I will go straight to Claire from the European Association of Working for Carers, because in this discussion we should always keep in mind the important role of the informal carers, and that role is really vital in the quality of life of cancer patients and how they get affected by cancer diagnosis or the carers themselves, either of a relative or a loved one. So Claire, thank you for being with us. Can you please give us a small introduction about Eurocarers, and also please explain to us why has Eurocarers endorsed the ECL's publication on cancer at work, and why is cancer important to you?
Yeah, thank you for the invitation. I think all these initiatives are excellent, especially as they also involve cancer carers and help breaking the taboo and open up the discussion in many places. So to introduce the organization I represent here today, Eurocarers, we are a network of organizations, both active in research and grassroots organization promoting the rights of informal carers, who are defined as every person who provides care regularly to someone in need of care, be it because of disability, age, or chronic disease. So we are working for all kind of care. The only common criteria are the fact that it is unpaid and that it's regular, because we believe that care is a very important reality in our society, which is undermining many inequalities and difficulties. And together with researchers engaged in different areas in relation to care, be it health economic, nursing studies, sociology, psychology, and groupings of carers willing to promote their rights, we are advocating for a better recognition and a better support for all informal carers, raising an awareness of the commonalities around their situation, in relation to social rights, but also isolation, and importantly, the lack of choice. Because what is important, we believe, is to give back to unpaid carers some choice. It's okay to be a carer if you want to do it, if you have the right support, but you shouldn't be forced to quit other activities if you don't want, if you're not a good person to provide care. So you should have alternative. And if you are an unpaid carer, it can be okay for some time, but it can come to a point where it's not possible for you anymore. So you should be able to reconsider and be supported. So we really advocate for choice and for alternative and for tailor-made supports around different situations. We've been cooperating with the cancer community for a long time. First, because in our community of carers, cancer carers are very vocal about their difficulties, which are quite acute. It's hard to provide care to someone with cancer. It's a long way, it's a difficult way with a lot of uncertainties, difficult way to navigate the complex health services, health system, to manage the finance, the social life, a lot of things. And also because on the other hand, the health community is well aware of the crucial role of the relatives of cancer carers who help comply with the treatment, go to the appointment, keep up with all the difficulties, keep hope, and also help with some well-being, some psychological comfort, and also often deal with all the rest of the life of the person, which is a lot. So a few years ago, together with the ECPC, we did a common white paper on cancer carers, and also with the support and the contribution of different organizations, including ECPC, we did an online toolkit for cancer carer, translated in a series of languages, which tries to give some tips and advice based on cancer carers themselves about this journey, saying that you're not alone and that some difficulties are shared by all, and that among them how to deal with your job, keep your job, and if you can, if you wish, how to discuss with your employer, and etc. But also many other topics, including also a list of good address in different countries. And this is, I'm posting the link on our website. This is still available. We believe that it's important to raise awareness of what is sometimes called the second invisible patient by some doctors. So the person who has some health difficulties also, besides the patient having cancer. We've been involved in advocacy towards the European plan against cancer, to ensure that carers are recognized, valued, and that the impact on their health is recognized, and that some concrete support is out for them. And we must say that the cancer plan brings some good points on this. It is quite advanced in the recognition of carers, and quite a good step forward. There was another step taken 2 years ago with the Directive on Work-Life Balance, which for the first time ever recognized informal carers. This is the exact wording. This is why we keep it, because this is how this reality is going to be recognized at the EU level, granting them some rights of 5 days a week, 5 days a year for leave for providing care. This is far from being enough, but that was the first recognition, and we really, it was accompanied by a series of recommendations to member states to go beyond in the support for informal carers. This directive has to be implemented this summer in all countries, so we really are looking carefully around what is happening. At the same time, we are quite involved in discussion, obviously, on what is going to be called a European care strategy to be unveiled at the autumn. And this strategy more or less arises from the impact of the COVID-19, which was a very important backlash for women in particular, but everyone providing care for a child, someone with a disability, someone with a disease, someone with age-related frailty, and also which raise a lot of concern around healthcare and social care in general. So the European Commission is expected to come with an ambitious strategy on care for children, but also for elderly people, and we insist that it will cover all types of care. And we certainly will insist, and we have good hope that it will be the case, that it will provide also some indication on how to support informal carers, which who in a recent report, SBC and Commission report, were categorized under the care workforce. So there's an official recognition that families, relative, informal carers are part of the workforce, which is, yeah, a bit questionable, but at the same time a reality, and which goes with some consequences if they are part of the workforce. So what is the support? Where is the money? Where is the training? Where is the recognition? So we're really working, waiting with great expectation toward this strategy, which logically will come together with strong pointers as regards how the EU funding, including the Recovery and Resilience Fund, should be used in reforming long-term care and health.
Thank you. Yes. Thank you so much, Clara. Unfortunately, we're out of time, but it's all been really, really important, and I'm really impressed with all things that's going on, and it's something that we need to perhaps discuss further. So I would like to thank again all the panelists for their contribution and their reflection. We are coming towards the end, and I'm asking all the panelists to switch on your cameras, and all the speakers, of course, for final remarks and some questions we already got in our Q&A session. There is one question that has sparkled some discussion among all of us in the chat room, because it raised an issue that has a lot of implications. If someone is applying for a job and before the interview gets a cancer diagnosis, what is the advice and what are his rights? So I don't know who wants to give a short answer. As I said, I've seen a lot of people discussing about that in the chat, but I'm not sure I was able to follow.
Thank you, Nicholas. I can answer this question from my perspective. So I would disclosure my diagnosis to my future employer, because the company and an organization needs to know how will be the procedures, because they will assign some information, some tasks and responsibilities. So there needs to be like plan B in any case of absence, and there needs to be like a backup plan for this. So I will disclosure my diagnosis to my future employees to ease the communication and for better working environment. Thank you.
Thank you, Mariam. But I guess I understand that it's something we cannot say for sure whether it's a requirement and policy legislation, whether it's on the patient's rights. I don't know if someone else wants to comment on this.
Okay, I can say something. Yes.
Yes, Erika,
how it is in Switzerland. In Switzerland, it's because of the insurances. Is this way that if the illness, if the disease has an impact on work, you have to disclose, you have to speak, because if not, you have a lack of insurance, daily benefits, and so on. So well, that's the legislation. And we recommend to be open to say how the situation is, because that makes it easier to adapt at work. But of course, it makes also fear to the employer. And then the employer could decide, oh no, I don't want to have anybody in my team, anybody new with a kind of disease, and I don't know what will happen. So it's really tricky, and the legislation in different countries might be completely different.
Okay, thank you, Erika. And focusing again back on cancer patients and survivors, perhaps, I don't know, maybe Haris can answer this question. How can the employers make cancer patients feel more comfortable with reporting their diagnosis and keeping in touch during and after treatment?
Yes, indeed. I will agree with the previous speakers. Cancer and any other diagnosis should be communicated with the employers, and it is a good opportunity that we, as we said, break this taboo of reporting illnesses within the working environment. Then, of course, another issue that would be quite helpful in order to achieve this is to increase awareness among the employers on how to deal with patients with special needs, on how to manage their daily workload or how to arrange their workflow and find alternatives. And I would say here that COVID-19 was the proof that there can be alternatives depending on the needs of the employees. So I'm sure that if we are all committed to find solutions, now is the right time, and especially now that the national cancer plans are formed, it's a good opportunity that we also include and discuss these aspects as well.
Thank you, Haris. And we are talking that it's still a taboo, and we all know of examples that even CEOs don't want to disclose their diagnosis. We've seen patients not wanting to, tell colleagues or even friends. So, are there any policies that can be applied to help create the right culture, and not just the right corporate culture, perhaps the right culture within a society? I don't know if Haris or someone else wants to give their opinion on this.
I would say again, but for me it's important that the culture of the societies towards this aspect needs to be changed because we have seen during the past years, I mean, Europe's Beating Cancer Plan is not the first discussion that we had around cancer. We are discussing the topic for many years now, and still we see that although there may be efforts and legislations, they are not always adapted, and they are not always becoming, let's say, a common sense for citizens that things should follow a specific route. So if we want policies to be successful, then we need to make them part of the society. And
Yes.
work for workplaces as well.
Mm-hmm. Yes. Does anyone want to follow on that question?
Hi, Nicholas. I would like to add on that, mainly emphasizing on the organizational culture, if I could.
Yes.
What I will say is that it is important for companies to focus on creating a psychological safe space for employees to disclose this kind of sensitive information. And we need to keep in mind that the patient, the employee that is going through cancer, is in a vulnerable position at that point, explained before by other colleagues. And the creation of this psychological safe culture does not start well before a case, well before the organization come across with a case of an employee who is going through cancer. And what you mentioned before about CEO and disclosing this kind of information, it helped me recall a case that I came across of a large corporation where the CEO, the top executive, was going through cancer,
and everyone was discussing on an informal forum about this. Everyone was knowing it, and they were discussing that as a corridor talk, I will say, but no formal discussion was going around this. And I'm conscious that this is also a personal decision which is need to be taken on. But you understand, as if you are the CEO of a company, then the lights are on you, and the decisions that are taken at that level, or the behaviors that are taken at that level, create the organizational culture, the taboo, and whether we feel comfortable to disclose this kind of information. So I know there are a lot of complexities, but these kind of decisions and behaviors can create specific organizational cultural context, which will break or not the taboo around cancer.
Thank you so much, Veli, for sharing. As we heard in the previous discussions, there are many differences across countries in the provision of support and services relating to cancer at work, even in culture. From your point of view, what can we do to minimize such differences? My question goes to Marin, but anyone, please, if you want to give your opinion, please do so.
Sorry, I missed the question.
Sorry, Marina, I haven't given you the heads up. So I'm just asking, from your point of view, can we minimize the differences we see across countries in the provision of support and services relating to cancer at work?
This is quite a difficult question. Unfortunately, at EU-OSHA, we don't have any power to change the legislation at the national level. The only thing we can do is to provide information then for the policymakers to change the legislation. So I think focusing on very practical advice for the employers is, I mean, that was mentioned again, I think by Vin at the beginning. Like, there are so many different contexts, national contexts, that what we can do is to focus on the practical level. But unfortunately, I don't think I have an answer to provide you with.
Yeah, I mean, I was thinking on how can we make the change on a national level. And then I was thinking of all the employers' federations we have in Cyprus. And I'm guessing they also have European bodies that are also members of those federations, like Business Europe or Euro Chambers, etc. So perhaps we should start a conversation with them and make the change on a national level, but coordinated under those European umbrellas, let's say. I don't know if anyone wants to make a point or comment on that suggestion.
I could possibly comment on that, because it's more or less how ECPC works. We are the European umbrella organization, and then it is within our scope to support our members in national level. So a similar model could also be applied for topics as the one as you mentioned, and the role of the European organizations in policy and advocacy is exactly that, to promote in a European level, but also support in national level then the organizations. And apart from the role of the organizations, the role of the members of the European Parliament is also important. So a strong connection between the European organizations and them is important, because then they will also go back to their countries, and their influence and their collaboration with the national parliaments can also influence the change.
Thank you, Haris. I see that Juan also wants to make a comment.
Yeah, very brief comment building on what Haris before me said. I think that indeed umbrella patient organizations such as the European Patients Forum are key positioned to serve as the bridge between cancer patients and their organizations, whether local or cancer-specific organizations, and the European policymakers. And then picking up on the very last point of my intervention before, any cancer policy, European policy, to be effective and to be fit for purpose, it needs to be co-created with patients one way or another. Otherwise, we'll miss this point. Thank you very much.
Thank you so much, Juan. So at this point, I just want to thank everyone. We are coming at the end. I know for sure that the conversation on the barriers around cancer and work is underway. We already heard some great examples, some best practices, and we all agree that ECL's handbook and leaflet is a good starting point to help spark this conversation on the grounds. I believe that we should continue to work in improving communication between all the groups, patients, survivors, carers, with the employers and colleagues and policymakers. And that's how we will create the analytical work required to change both the culture and the systems across Europe and across all European countries in order to break this taboo. Again, due to the lack of time, I will leave it at here. I would like to thank the speakers, the participants. I would like to inform the audience that the ECL will send a thank you email with the recording of the event and the slides in due time. And finally, please allow me to say a big thank you to our ECL colleagues, to Gina, Flor, David, Wendy, and all the ECL secretarial for making this webinar a reality. And I hope to see everyone soon. Thank you and goodbye.